I want to talk more about cytokines, inflammation, bladders, COVID, irritated bladder, urinary frequency. Let's get into more science. I'm going to pick back up where I left off. So in the post before, I was talking about this article from 2020. It's a Medical Hypotheses, and they are looking at the COVID-19 inflammation results in urine cytokine elevation and causes COVID-19 associated cystitis, CAC, which is basically overactive bladder, COVID style. But let's get into more science. This is part 2 from this other one. So in this article, they go on to say that in overactive bladder, they know that there is urinary cytokines that are elevated in these patients that have these grumpy little bladders. They also go on to say that urinary cytokines are elevated in people with interstitial cystitis, which is IC, with the Hunner's lesions, specifically interleukin 6, interleukin 8, and GRO. Overactive bladder and IC are painful bladders, and it sucks. They are non-bacterial cystitis, and cystitis means irritation of the bladder. This article is talking about how COVID irritates the bladder, and it's showing you this is what we know. We're hypothesizing that cytokines are in the bladder irritating as well, but we don't know. COVID symptoms, bladder symptoms, it's all new. Let's get into it. This is still a hypothesis. So cystitis, or bladder inflammation, can cause bladder dysfunction, and that's why you're following me right now. Inflammation can occur from lots of different things. It can be bacterial or viral, right? So a non-bacterial cystitis, it can be a viral cystitis, it can be from radiation, it can be from chemical irritation, it can be idiopathic. There's a host of reasons your bladder can be mad. They go on to say pro-inflammation mediators, including cytokines, can damage and irritate the bladder mucosa. That is the lining of the bladder. It becomes grumpy, pain, red, and inflamed. Think of a sunburn inside your body. They go on to explain why it's going to hurt you so bad, because the bladder mucosa, if you didn't know, the inside lining of your bladder is a dynamic sensory structure and can sense bladder fullness, and it has deep feelings and can sense things, because guess what? That's what it does. It tells you when it fills up. And if it's irritated on the inside, you're going to feel that pain. So because the bladder is so sensitive, damage to this mucosa can result in a bothersome lower urinary tract symptoms, because of the damaged tissue may activate the afferent nerves as well as locally influence the bladder muscles. Then the SARS-2 virus, the COVID virus, can result in systemic inflammation. This has been referred to as a cytokine storm or cytokine release syndrome. This increased expression of cytokines, C-reactive proteins, all of this is the best single prognostic indicator of COVID-19 severity. They hypothesized that the cytokines in the urine could impact bladder sensitization, and that's why you have frequency.